First, I'm going to pour some purified water on the surface of the hood, just a little puddle. I'm going to put my 4x4s there, just kind of let them soak up the puddle, distribute the water. Then I'm going to clean from back to front, side to side in overlapping motions. Then I can throw these 4x4s away. I'm going to get my alcohol. I'm going to pour another small little puddle in the middle of my hood. Get more 4x4s. Let them soak up my puddle. Pat it down to distribute. Then I'm going to clean again, left to right, side to side, overlapping strokes. I clean first with my water to remove any water-soluble residues that might be on the surface of my hood. And then I clean with alcohol to decontaminate. Now I'm going to assemble my supplies. Now I am ready to begin my preparation. First, I'm going to open my 10 cc syringe. Then I'm going to open my hypodermic needle. I'm going to remove the cap from my syringe. I'm going to assemble my needle and syringe. Then I'm going to remove the dust covers from my Practi powder vial and my water diluent. I'm going to open an alcohol. I'm going to clean my water. Then I'm going to clean my powder vial. I'm going to draw up 10 cc's of air. I'm going to remove my cap. I'm going to insert it, bevel up, 45-degree angle, turn it upright, insert straight in. Then I can flip the vial, making sure that I'm not blocking airflow past my needle. I'm going to inject some of the air, and I'm going to draw back fluid. I'm going to turn my bottle so I can see the needle in the fluid. I may have to back up my needle just a little bit. Inject more air, draw up liquid, and I'm going to continue to repeat that process until I draw up my full 10 cc's of fluid. Okay, I'm going to remove my vial. I'm going to get rid of any air bubbles. I'm going to draw back air, and then I'm going to get rid of the excess air that's in the syringe, making sure that I don't aim my needle back towards my filter. Okay, then I can take my syringe and insert it into my powder vial. Okay, again, 45-degree angle, bevel up, and then insert my needle, my syringe directly in. Then I can use the milking technique. I'm going to inject my liquid until I have it all injected. I'm going to wait until the pressure equalizes, making sure that my plunger is not moving anymore. Then I can remove my syringe. I'm going to carefully recap. Okay, remove my air so I don't forget later. Now I'm going to mix my powder vial. I'm going to roll it, or I can swirl it. Not going to shake it. I'm going to do this until it is completely mixed up and all the powder particles are dissolved. And I can alternate between the two methods, but I never shake so I don't introduce air or air bubbles into my solution that I could potentially draw up. All the while I'm doing my preparation, I'm making sure that I remain 6 inches within the hood, making sure that all of my supplies are 6 inches away from the side. Once I have all of my powder dissolved, I'm going to again take my syringe, uncap, bevel up. I'm going to insert not in the same hole that I inserted into before. I can invert the vial. I'm going to turn it so that I can see my needle in the fluid. I'm going to make sure my fingers and hands are not blocking airflow so I can hold the vial with my index finger and my middle finger here around the neck of the vial. And then I'm going to draw up my desired amount of fluid. There is going to be a vacuum effect. So I'm going to have to pull a little bit of pressure. I'm going to remove any air that's in my vial before I remove my syringe. Once my pressure has equalized, I can remove my syringe. Okay, again, I'm going to double check to make sure that I don't have any air bubbles. I'm going to draw back and then push out any air that might be in my syringe. Once I have all of that out, now I can insert my syringe, or I'm going to recap my needle, and I'm going to set it aside for my pharmacist to check before I inject into my IV bag. Now I'm going to move on and work on my ampule. I'm going to take my 3 cc syringe. I'm going to remove it from the package. I'm going to remove the cap from my filter needle and from my syringe. I'm going to assemble. Now that is ready to go. I'm going to open my alcohol prep. I'm going to clean the neck of my ampule. I want to make sure that I don't have any liquid up in the neck of my ampule. If I do, I can swirl it around. Make sure that my ampule is clean. And I can set it aside. I'm going to take my 3x3 or 4x4. I'm going to open another alcohol prep, a clean one. I'm going to set it on top. I'm going to wrap it around the neck of my ampule. I'm going to turn it at a 20-degree angle. I'm going to break the cap. I'm going to set that aside. Now I can remove my cap, bevel up. I'm going to insert into my ampule, and I'm going to draw up all of the fluid in the ampule. I don't have the steadiest of hands when I do this. Again, I want to make sure that I'm not blocking blood flow. And as I get towards the bottom, I can actually raise it up in the air if that is most comfortable for me. And I'm going to use my thumb to draw back my fluid. Now, once I've gotten all the fluid out, I'm going to remove it. I'm going to turn my needle right side up, or my syringe. I'm going to draw back some more air. I'm going to get rid of any air bubbles. I'm going to eject my air. And when I get rid of my air, I want to make sure that I'm not facing the back side of the flow hood where my filter is. I don't want any fluid to accidentally squirt out on the back of my hood. So I'm going to remove all of the air. I'm going to recap. I'm going to remove this used filter needle, get a new filter needle, remove the cap. I'm going to assemble, and now again, I'm going to set this over to the side for my pharmacist to review before I inject it into my IV bag. Once my pharmacist has checked, now I can inject my medications into my IV bag. For my reconstituted powder, I'm going to use the large IV bag. I'm going to tear it open. I'm going to set it to the side. I'm going to take one of my alcohol preps. I'm going to tear it open. I'm going to swab the injection port on my IV bag. I can set these aside now that my pharmacist has checked. I'm going to take my colored additive. I'm going to insert it into the injection port, bevel up. Make sure that I inject straight in, not towards the sides, or it could puncture the side and go through. And then I'm going to inject my medication. I'm going to, again, recap carefully so that I don't poke myself. I'm going to set that aside. I'm going to agitate my bag, and I'm going to put it label down when I'm done. Then I can set aside my ampule because my pharmacist has checked. I'm going to take my smaller IV bag. I'm going to remove the dust cover. I'm going to swab my injection port. I'm going to uncap my changed filter needle. I'm going to insert, bevel up, straight into the bag. I'm going to inject slowly. I'm going to remove my needle, recap so I don't poke myself. I can set that off to the side. I'm going to gently agitate, I'm not going to shake. I'm going to lay it label down, and then I dispose of my sharps in a sharps container and my trash in the garbage.